medication issues. Make sure, and this is more in the seizure realm of things, make sure your doctor documents in his notes. So make sure when you're in the office that he knows, because sometimes when you're seen in the emergency room, those notes might not get transcribed. And with the era of electronic medical records, I'm fighting with my institute for a year trying to get our two systems to meld together so that when a patient's seen in our ER, that it goes automatically into our electronic medical record. So make sure that when you see your doctor, you say, you know, I was in the ER, do you remember that I can't take this, or I have an allergy to this medication, so that it's documented in your chart. Just remind them, or whoever's taking the intake, because when we have to appeal this information from the doctor's notes is going over to the company. Side effects, any problem that you've had on a medication, make sure you're mentioning it, so that, again, we can document it in the medical record. And always remind your doctor, our authorizations are so point specific now that we really need this information. So where do I go to for medication assistance? There's a couple copay relief programs, and I do list them on the next page that I use. The problem with the copay relief forms that I'm programs is that they max out. So they're great in the beginning of the month, and by the end of the month they max out, and you have to wait till July 1st, and they'll put that on their recording. So there's a couple more copay relief companies now that when you Google it even, you'll see them on. On my next page, I do list patientadvocate.org. They've helped patients, but more recently I've heard that they're not getting back to patients as quickly as they did in the beginning. Drug company assistance programs, what they're going to too, we get samples, but I can't get samples of like Timidar or Avastin or any, and if it becomes a generic medication, they won't give us the brand name anymore. So what they're giving us is voucher cards. So that if your copay is $50, they'll pay $25 of that copay. So you can ask your doctor, do you have any voucher cards? Because even people that don't have samples in their office, they will give them the voucher card so that you have these coupons. And the assistance program, all the drug companies have them. It just depends if you'll qualify for it and if they're not disbanding it. Some pharmacies do have local programs. And I hear this from patients. I tried to Google it to give you some more information on it, but I know we've had problems where Walmart would charge one amount for a drug, and then we'd call over and Costco was less, so we would switch to that. So different drug companies, depending on their suppliers, even with generics and everything, they will charge you a little bit less, so you can kind of drug shop with your pharmacies. But the one person is using Walmart, and he pays a set fee to get his Zofran. So he pays $25 a month, and he gets his, so many months supply of Zofran. I'm not sure really how it works, but it only works with Zofran. It didn't work with Keitel. She had an allergy to Zofran, so we were kind of in the same boat and had to end up giving her a suboptimal anti-nausea for her Timidar because it was $18, and that, we don't use Compazine that often because it has side effects, but we had no choice in this patient. And some national brain tumor programs might have relief forms, so you can go onto them, and I did list those at the end of the talk, and look up if they have any programs that they're using for patient assistance. Patientadvocate.org. The other one is PPARX. That's also a patient, and what that one does, the patient PPARX, I forget what it stands for, but that will gear you towards, like if you hit Timidar, it'll send you to the Merck Helps program. And so Merck Helps is the drug assistance program that they have for Timidar. Genentech, Access Solutions, they've actually been very wonderful with both. When Avastin was not FDA approved for second-line treatment for GBM, they were wonderful about giving the drug to us for free. I set many people up under that program. And then copays.org is another one. I missed that one. And again, check in with your local pharmacies.